Okay, is it a myth that if the maxilla is held back, that the mandible or lower jaw will catch up? Or does restricting the growth of the upper jaw also restrict the growth of the lower jaw as well?
My personal experience back when I used to use headgears over 30 years ago was that indeed it is a myth. What my experience is, and what I've seen, and I can look at patients that others have treated, I think it's really like the dog chasing his tail. The more the patient wears a headgear, the more it pushes the upper molars back. And as the upper molars go back, they not only go back, but they go down vertically. As they drop down vertically, it causes the lower jaw to hinge back and the chin falls back. So the more the patient wears the headgear, the worse the jaw relationship actually gets. The lower face gets longer and longer and the chin falls back. I call this the dog chasing his tail. The typical scenario goes where the child is wearing the headgear like crazy, but the problem is getting worse. So the orthodontist says to the patient, you have to wear it more. So they wear it more, and it gets worse yet. So always the orthodontist is chiding, well, Johnny, you're not wearing the headgear enough, and pretty soon the child is wearing the headgear 26 out of every 24 hours, and it's getting worse. And that's about the time when it gets so bad and the face is so long and the orthodontist is frustrated. Then he says something about, well, you have a tongue thrust, and finally refers for myofunctional therapy. That's like sending the fire truck in and to take care of a huge million-acre brush fire and try to put it out with a squirt gun. The problem is the headgear has made the oral posture worse, it's made the facial balance worse, and the child has no hope of getting the teeth together. Those are the cases where the treatment goes 4, 5, 6 years, and it usually ends when the patient just is had it, and they throw the towel in. It's like the dog chasing his tail. The dog finally falls on the ground, exhausted, and stops. That's what happens, and I see this time and time again. And I have in my lectures, I have examples of this.
Bill, what is head tilt forward posture, and does retraction and headgear create that?
Can you repeat that again?
What is head tilt forward posture,
Oh, okay.
and does retraction create that, or I think
Okay. Yeah.
it's forward head tilt posture?
Okay.
Yeah.
Many people will hold their head forward and tilt their head back just because they can't breathe. We call it forward head posture and head tilt. It gets their chin forward, their tongue is forward, and it opens their airway. If you sit and watch people in an airport, for instance, walk by a corridor, you'll see lots of people with forward head postures. They're walking, their head is tipped back. If you try and put their head over their shoulders and make their forehead go straight up and down, because the forehead should be vertical, they couldn't breathe. Their airway would kink off like a garden hose. One of the people who's taken my mini residency is a dentist who I helped him learn to reopen his extraction spaces where he'd had teeth removed. He did that, and after doing it, he took pictures before and after, and his head tilt improved by 15 degrees. In other words, his head became more vertical rather than tipped back. Now, that has a huge effect on the pain that a patient may have in their cervical muscles here. If they have forward head posture and the head tilted back, these muscles will tend to be very, very sore. And in reversing that process, that pain may well go away. I see this all the time in the patients where we do reopen extraction spaces.
Okay.